Now, for more on the Omicron variant is Chief Innovation Officer, Boston Children's Hospital, and ABC News medical contributor, Dr. John Brownstein. Dr. Brownstein, thanks so much. It's great to have you here to sort through all of this. And this morning, there's something pretty big to sort through. So let's start with that major news from the CDC, cutting in half the isolation time for people with asymptomatic COVID infections from 10 days down to 5. Given how rapidly Omicron is spreading across the country, first, is 5 days of quarantine enough to stop the spread of the variant, do you think?
Well, good morning, Phil. I do think 5 days is enough, but with some caveats. I mean, we have to be updating the science on isolation as we accumulate more data. We know more about infectiousness and transmission. And so what we know now is that 5 days is probably enough because, we have 1 to 2 days prior to symptom onset, you can be shedding virus, and probably 2 to 3 days after that, you're still contagious. So that 5-day average makes a lot of sense. Remember, we're also balancing the fact that we're trying to get people to adhere to isolation. We know that there's the economic burden of isolation. So, as we have just so many cases, we have to be realistic in terms of what we can expect people to do. There's a couple caveats. If you have any ongoing symptoms, you need to do that full isolation of 10 days, or at least until those symptoms subside. And also, masking is important. If you are out at 5 days, keep wearing that mask for another 5 days. That will help reduce transmission. We know that Omicron really has changed the game, and there's just so much transmission taking place in the community. So whatever you can do to limit the risk to others is super important.
You mentioned being contagious. I have a couple questions on that in just a minute. But first, the CDC is also not requiring people to get a negative test result to end isolation. Is that a mistake, do you think, to not require at least one negative test?
That baffles me a little bit, I have to say, because not everyone can clear the virus in about 5 days. Some people take 3 days, some people can be over 10 days. And so things have changed, especially people are testing earlier with Omicron. So I'm worried. And in fact, I'm recommending to my friends who are finding themselves infected to get that rapid test. And if they're negative after 5 days, that's a good sort of sign that they can leave isolation still with masking. But, I don't know why CDC didn't recommend it. It might be because of lack of availability of tests, but that shouldn't be a reason why, we shouldn't be requiring, at least asking people to get that additional, layer of protection.
Yeah, the testing is a problem. The president and the administration says that will get better in the coming weeks. But right now, as you saw in Victor's piece, lines for testing, and it's just really difficult. What I love having you here for is not just your expertise, but answering the questions that so many people are asking. And this is one that we've heard a lot. If you've had COVID, say, for a week or a week and a half or something, and you can test, you can still test positive, right? But when do you know you're not contagious anymore if you still can test positive? What's the best way to figure that out?
Right. And of course, it depends on the test as well. The PCR test is very sensitive and has been the gold standard. It can identify pre-contagious period, during contagious, but also post. And so you can test positive on the PCR for many days, but actually not be shedding enough virus to transmit. This is why I really like the rapid test, even the at-home test, because that is a direct measure of contagiousness. And so if you can get access to those at-home tests, or you can go to an antigen, a testing site, and you test negative, I would feel much more confident that you can get out of isolation. Now, I think that additional masking is super helpful, but that really is a good test and a good marker of the fact that you were not shedding enough virus to put yourself at risk to others.
All right, we're coming out of the holiday season, Christmas most recently, and we are heading into New Year's, both times where people gather with family. Looking ahead to the new year, which is just in a few days now, should people be keeping in mind as they think about celebrating that COVID still is spreading? And I know a lot of people are going to be gathering in Times Square. Are you concerned about these things?
Yeah, oh, for sure. I mean, we've seen this situation before. We're sort of in the middle of a surge and a big holiday where people are moving, they're gathering. It's all on us to try to reduce transmission as we head into these coming weeks. And so, obviously vaccination is our best weapon, but testing is super critical, especially as you go into a gathering. If you don't have availability of testing, if you have symptoms, I would just assume that you are likely positive and to not travel or gather. Obviously, masking, social distancing, all the things that we know work, good ventilation. I am worried, though. We always have this situation of a surge, and then you layer on a holiday, and that's when you get an explosion of cases. And what we're trying to do is, of course, limit severe illness that could impact our health systems, cause unnecessary hospitalizations, and unfortunately deaths.
And that leads me to this final question. We heard in Victor's piece about the reported rise in COVID cases among children. Given the spike in pediatric cases and hospitalizations, some school districts are weighing whether to delay returning to school after the holidays. This is certainly a hot button topic. What's your take on it? And do you think students and teachers should be tested before going back to class?
You know, I think this far into the pandemic, I think unnecessary quarantine and closures is just too much for our kids. I think we know enough now to prevent that. So we know that it's about masking, social distancing, good ventilation, and testing. You know, we've had this concept of a test to stay program. It's at my kid's school. You know, you test and you decide, you know, identify anybody who might be infected, and then they have to stay home and isolate, but you don't necessarily impose that on the entire school body. Kids need to be in school. They need it for their mental health, for their social, you know, interactions. And so I would say, you know, let's focus on testing, and we know it works, and keep our kids in school in the new year. I mean, they all need it.
Yeah, exactly the way my son's school's working as well. Dr. John Brownstein, thanks so much for taking the time this morning. Always a pleasure to talk to you.
Thanks so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.